Delighted to be joined now by the Foreign Secretary Dominic Raab. Welcome to Talk Radio. Good morning to you.
Good morning.
Good morning. We've had a whole load of new rules affecting our lives, extension of the rule of six, this 10 p.m. curfew, and possible talk that this could be lasting for 6 months, Christmas cancelled, New Year's Eve cancelled, possibly the chances of us not being allowed to visit other households coming up, as well as has happened in Scotland. Can you tell me what cost-benefit analysis was presented to the Cabinet before you agreed to these measures?
We took into account all the different economic implications, but of course, as ever, all the scientific advice. Just in terms of cancelling Christmas, I think we're taking these targeted and proportionate measures precisely to avoid a second national lockdown, which would end all of the social interaction, put a hold on retail that is reopened, and have all the social impact that I think we'd all want to avoid. So it's precisely to avoid further more drastic measures down the line that we've taken the focus measures that the Prime Minister announced last night.
Okay, so there's been a cost-benefit analysis presented to the Cabinet. You have seen, for instance, charts showing how many lives you expect to save from these new measures and how many lives will be lost as a result of these new measures in terms of the long economic effects, cancer treatments not going ahead and the like. Can you tell me then, how many lives will be saved and how many will be lost? What is the cost-benefit analysis?
No, it's not. I'm afraid it's not as precise as that.
Oh, so we haven't done that then?
Sorry, Julia. Let me answer the question. We get advice that's presented by the scientists. The Treasury, of course, do their analysis. The business secretary and the chancellor feed in, and the reality is there'll be an element of judgment. What we know, though, in terms of, for example, the fatality rate, we've made huge progress since the peak in March and April. We've got an increase in cases and the transmission. What we don't want to see is that translate into the very high spike in deaths that we saw earlier. And it is precisely in order to avoid that we're taking the targeted measures in the specific areas that we think will have the most impact.
Okay, and how many jobs and businesses will be lost? Has there been any presentation to the Cabinet about that?
So, of course, you'd expect the economic impact to be fed in. I'm not going to reveal all the details.
And we know. So, are we not allowed to know that? So, can I just? I don't mean to interrupt you, but you're saying that the Cabinet has seen documents saying just how many jobs and businesses are expected to be lost, but the public aren't entitled to know that?
Well, I didn't say that. What I said was, and of course, I want to be very careful to protect the integrity of the cabinet discussions. But as you'd expect, that is the forum where all of these factors can be considered, and it's right to say that, for example, some of the 10 o'clock limit on bars and restaurants, that will have an impact on the revenue of those businesses. But what we're saying is that we need to take these measures. There's an evidence basis for that. I can touch on that if it's helpful. But we need to take these measures to avoid the hospitality sector going into a more severe lockdown, which would be an even greater challenge and a greater hit to the businesses and the jobs affected.
Are you basically saying that we, the public, have to just simply trust that the medics and the scientists and the government, in this case, have got things right? And are we not to be trusted with the full cost-benefit analysis of what the benefits of doing this are and what the cost to lives and livelihoods is? Are we not to know those figures?
No, and of course there's a huge amount of data that's being released on that shows the impact of the virus day by day, week by week. The Chancellor will set out his economic estimates and forecasts. All I'm saying is this, and it's a fundamental pillar of our approach to government, is that the cabinet discussions, the integrity of them needs to be respected. Otherwise, you don't get the frank and candid discussion that means you get smart decisions, which I think your listeners would want.
Well, I think we'd like those frank and candid discussions to go ahead in Parliament where we can see them. The latest Public Health England report has revealed that 10 times more outbreaks of coronavirus are happening in care homes right now than in food outlets and restaurants. Why are we then limiting the work and the hours of food outlets and restaurants rather than protecting care homes where we know the most vulnerable people live?
So, of course, we're focused on that. We're reinforcing the measures, the care and the safeguards around care homes, and of course the intra-hospital infections, which was, if people think back to the last peak, a key challenge. We've come through that. We want to preserve the gains we've made, and of course we know that the over 65s are a particularly vulnerable group. So that is all. Those measures are in place. The reality, though, we've also seen an uptick in transmission amongst younger people, and we know, and the evidence from our localised lockdowns, but also from Belgium, which has got some experience of introducing, for example, the 10 o'clock limit on bars and restaurants. That's, as one measure, a way of bearing down on the transmission in those different aspects.
But you say the measures are in place for care homes. If the measures were in place, we wouldn't see 10 times as many outbreaks in care homes. I've got an aunt in a care home. She's been tested twice this entire year for coronavirus. I thought we were supposed to see testing once a month for all care home residents and once a week for all care home staff. That's not happening in most care homes. So we haven't got those measures in place, have we?
The big challenge in care homes has been the ebb and flow of people into them who may be asymptomatic but are transmitting the virus. That has been the single biggest challenge, and of course the social care system is localized, it's decentralized, unlike the NHS, which is more centralized system. So there's no doubt it's been a challenge, but all of those actions and those measures have been put in place to deal with that, but also things like the PPE and the testing as and where it's required. Of course, we've got ramped up the testing capacity. Per capita, we're ahead of any other country, certainly leading the way in Europe, but we have prioritised frontline NHS staff, social care workers, which touches on the care sector, and those other prioritised areas. And there is still a prioritisation that needs to be done, given where we are with the testing capacity.
Okay. All right, 100,000 tests have been, we're told by Matt Hancock, given to care homes. Most care homes are saying they're simply not getting them. We know we've got hundreds of thousands of people in care homes, and we've got millions of people working in the care home sector. So 100,000 a day isn't really going to fly, is it? Back in March, we were told by the Prime Minister that the aim was, with Whitty and Vallance by his side, to have a lockdown. And one with which I fully agreed, by the way. We had a disease we knew very little about, and we had very high rising figures. And I think as a nation, pretty much everyone agreed that this was the right thing to do. But we were told the aim was very clear. We were going to flatten the curve. Remember that sombrero graph we had? And we were going to protect the NHS from being overwhelmed. Give us time to get enough ventilators, get enough beds, build those Nightingale hospitals and the like. Right. We've done both of those things. The curve is flattened. Even the worst case scenario curve doesn't look anything like what we were seeing at the peak in April. Certainly when we look at the trajectories followed by Spain and France, there is nothing remotely akin to what we saw back in the spring. So we've flattened the curve. The NHS has got enough capacity. What's the aim now?
So you're absolutely right to track that progress we've made. Great credit to all those involved, including the public. But we always were clear every step along the way, and you'll remember the 5 tests for easing up on the lockdown, that we needed to have the targeted measures in place to prevent an uptick in the virus, not just the increase in the number of cases, but then with the lag that's involved, time lag involved, the increase in the fatality rate. And all of the evidence that we've had, the scientific, the medical evidence, is that if we don't bear down on the transmission, the number of cases now, we will see an increase in hospitalisation and fatality rates down the line. So we're taking the targeted measures to prevent that uptick and to prevent having to go even more drastic measures further down the track. And I think the public overwhelmingly by 78%, according to the YouGov poll last night, back that.
They do, because if you send out Chris Whitty and Patrick Vallance to tell us that we're going to have hundreds of deaths in mid-November and tens of thousands of cases in mid-October, then people will be frightened into going back into their homes, won't they? But
well, Julia, you started off the interview saying we didn't have enough transparency. We put the scientists there, full front and centre, so you can hear it directly.
Where was the
Q&A? And now you're complaining that we've done that. I think people expect that we've got the right level of communication of the facts in relation to this disease. I think people do appreciate the fact that Chris Whitty and Patrick Vallance best placed to provide that. And then you're right, the elected politicians have got to take the judgment calls on what's the proportionate focused action that we take to see off further problems down the line.
For a start, there wasn't any opportunity for anyone to ask any questions of Patrick Vallance or Chris Whitty, but also Patrick Vallance, I mean, he said specifically twice in that presentation on Monday that it was not a prediction but an example scenario where we would have 49,000 cases every day mid-October and 200 deaths a day mid-November, and on that basis we would end up seeing just exponential growth. That he said also that we were following on the trajectory of Spain and France. Spain and France are not following along a trajectory anything like that. Loads of analysis from eminent experts, statisticians, epidemiologists, virologists and the others have pointed this out. Has any of the cabinet ministers in the meetings, you want to keep these meetings private, but has anyone actually raised any issues about the scientists and the experts who are questioning any of the assumptions made by Sir Patrick Vallance and Chris Whitty?
Oh, the advantage of having the cabinet discussions. We can test very carefully the evidence. You'll always get and the media is full of the Goldilocks commentators or indeed scientists who think we've gone in too hard or we've gone in too soft. That's been apparent to me as I've done my media round this morning. I can tell you, though, I think if you look at the balance of opinion amongst the scientific community, that Patrick Vallance and Chris Whittier are right there. But crucially, they provided the evidence basis for the action, the measures that we take political responsibility for. But you're absolutely right to say we test very carefully that evidence. We want to make sure we get these decisions right. We want to make sure critically, though, we don't go into Christmas in the full-blown lockdown with Christmas cancelled, as journalists have been putting to.
So you've raised the issue of the reliability of these tests. You've raised the issue that when we say we've got cases increasing, actually these are positives, a large number of which may or may not be false positives. You've raised the issues of the failures of test and trace and all of those things. Those have all been raised and discussed at Cabinet before this was agreed.
Well, I'm not going to go into the specific discussions, but what I can reassure you, and more importantly, your listeners, is that there's committee after committee and rigorous testing of all of the evidence in all of the areas that you cite and many more besides.
And if you raise the issue of the fact that we know that all viruses like this are seasonal, and therefore it was entirely predictable as we came out of lockdown, and of course as we head into autumn and winter, that we, like every other country, would experience some rise in the virus and in terms of cases and deaths, and that this was predictable. Would it not perhaps be a more reasonable response to point this out to people and explain that, yes, there will be, until we have a vaccine, increased cases and increased deaths from this virus? Would that not be a more realistic, honest way to talk to the public?
I think, in fairness, Julia, we've said all along that the autumnal and winter months would be more tricky because the virus thrives and is less easy to control than in the warmer months, and therefore we'd always been clear that whilst we'd open up as soon as and in incremental stages when it's safe and responsible, we would have to take a suite of measures, preferably localised, but if necessary at the national level, to prevent further more drastic measures, which I think you would rightly want to see us avoid.
Okay, just finally, the Boris Johnson yesterday said that the vast majority of people had obeyed all the measures, and he said that, that some people have not, and you're going to toughen up the punishments for those people. But isn't this effectively the government blaming us for the government's own failures of test and trace and controlling this virus?
No, I think that first of all, we're paying tribute to the overwhelming majority of people who've followed the rules, who have tried to be as conscientious as possible. We recognise it's difficult, but saying right now to prevent the uptick that we've seen in a number of cases turning into the level of fatalities that we've seen before, we need even more consistent compliance across the board. It's not okay for a few people to think that the rules don't apply to them. We don't want a very small minority blowing it for the overwhelming majority.
Okay, just going to ask you this question because I'm asking all of our cabinet ministers this question these days. Do you know the number of people in this country who have died in hospitals in England since the beginning of February to early December who are healthy under the age of 60 with no underlying health problems who have died of coronavirus? Do you know roughly what that number would be? Do you want to make a guess at what it might be?
So I don't know the precise number. What I would say is that
rough
we know
idea.
That
Rough idea. 10,000,
20,000,
100.
Come on. We know that the overwhelming majority of people are the over 65s and those with multiple conditions, particularly respiratory or cardiovascular conditions. But I don't have the precise figure.
Do you want me to tell
happy
you the
to
number?
I'd love you to.
307.
Well, look, I appreciate this. We know more and more about the virus week by week, month by month, and we know disproportionately hits older people and those suffering with the conditions that we've described. But we're interconnected, and the transmission via younger people. We're all parts of families, and actually the risk to people across the board is still there, and we've got to look at this in the round. Sorry, please.
Apologies. Would it not make more sense to shield the elderly, shield the vulnerable, the people who are most at risk, people in care homes, which clearly we're not doing again? We're going to make the same mistake again. Make sure that they are as safe as they can be. And meanwhile, let everyone else go out and about with social distancing, hygiene, wearing the masks, all in favour of all of that. But actually getting us back to some semblance of normal life, boosting our economy again, making sure we've got enough taxes paid to pay for the healthcare service we all care so much about.
Look, you're absolutely right. It's a balance. We are taking those measures to protect the most vulnerable and the elderly without somehow sequestering them entirely and putting them into in sort of something social incarceration. I don't think that would be effective, let alone anything else. But it's right to say we need to be focused on the disproportionate impact of the virus on them. We have also eased up, opened up businesses, schools to allow life to start to get back to normal. And on the testing and tracing, we've ramped up the capacity and the ability, and our per capita testing rate is the best in Europe, ahead of any other major country. It's all they're all elements in the overarching strategy that we're adopting. There's no silver bullet here, though, Julia, and I think it's misleading for anyone to suggest that there is.
Okay, thank you very much for joining us and answering all those questions. I appreciate your time. Foreign Secretary Dominic Raab